everyone. First of all, let me thank you all for having come here after your busy schedules today to listen and encourage Dr. Tara. Dr. Tara is an intern at KMC Bangalore, and on behalf of KasturbaMedicalCollege, Manipal, I extend a warm welcome to Dr. Tara and the entire faculty and students and interns who have come here to encourage her. I think the presence of the musical instrument here itself has created a divine aura, and I'm sure the music will enhance it further. Let me request Ms. Pragna to give a rose and invite and welcome Dr. Tara. Dr. Naveen Salins, Professor and Head, Department of Palliative Medicine, is here with us as the chief guest and will also chair this session. I request Pragna to give a rose and welcome sir. I take the pleasure of introducing Dr. Tara. Actually, when we asked Tara for her CV, I got an 11-page CV. It was very difficult to summarize it and give you the brief introduction of Dr. Tara. Wonderful achievements at this young age. Dr. Tara is presently, as I told you, she's an intern at KMC Bangalore. She's basically from Palakkad, Kerala. She has an excellent academic journey right from her childhood. She was the recipient of the prestigious Rashtrapati Award at the age of 14 and prestigious Raja Puraskar Award at the age of 13. During her third year and fourth year of medical schooling, she has received ICMR grant and a Manipal University grant for her project on non-Hodgkin's lymphoma. She is also currently working on a project on breast cancer also. She has also received a travel grant from AFMC College, Pune. She has done her electives for 4 months at Oncology, Howard Medical School, Boston, in Cardiology, Unicardio Medical Center, Florida, and in Malignant Hematology, Weill Cornell Medicine, New York, USA. She had confirmed placements of Pediatric Hematology Oncology in New York, Outpatient Medical Oncology Cancer Center, Stanford University, California, Hematology, Stanford University, California. She was an observer at Neuro-Oncology, Dana-Farber Cancer University, Howard Medical School, Boston, and I think that's where her passion for music to be integrated into oncology has come up. She has been selected as country's top 15 finalists for the prestigious Rhodes Scholarship 2018. This scholarship, we have only 5 students from India who are chosen for this. It is for their outstanding performance in scholarly and extracurricular achievements, their character, commitment to others, to the common good, and for the potential for leadership in whichever domains their careers may lead. She was also shortlisted for the interview for admission to the DPhil in Oncology, University of Oxford in 2018. She has a number of publications in national, international journals. She has presented at various conferences internationally. Coming to her music career, she has started learning Carnatic music at the age of 4 and Veena at the age of 8. She has graduated in a formal manner from the Annamalai University with Veena as the main subject and vocal as ancillary. She has also done her Masters in Fine Arts, again Veena, from Annamalai University. She has given a number of performances at various music festivals and on All India Radio. Recently, she's given a performance at Stanford University as well. She is also a dancer and has won an award in the South Indian Classical Dances Bharatanatyam and Kuchipudi at an annual dance festival. Presently, she is also a co-principal investigator in a randomized controlled trial on the effect of Indian classical music for chemotherapy and radiotherapy-induced anxiety, pain and mood disturbance in head and neck cancer patients, a pilot study. I think that is in brief about Dr. Tara Rajendran. As the quote goes, allow your passion to become your purpose and it will one day become your profession. Here we have this young doctor who always wanted to be an oncologist, now with a passion for music. I'm sure one day she'll excel in all her areas and passions. May I now welcome Dr. Tara. The stage is all yours.
Thank you, Dr. Veena Naik, ma'am. That was such a wonderful and kind introduction. It's such a pleasure to be here in this beautiful venue. This is a special evening today because this is the university that gave me wings to fly. And I am deeply appreciative of the exceeding kindness of Dr. Pragna Rao ma'am, the Dean of KasturbaMedicalCollege, Manipal, who gave me this honor and privilege to stand here. I am appreciative of Dr. Veena Naik ma'am for organizing this event. Thank you, sir. Thank you all. I welcome you all to Oncology and Strings, and I'm truly grateful that you're here. Ma'am had already given a wonderful introduction of me. The first picture is from my very first invited National Music Festival. I was 9-year-old. And second one is the Veena of the same from age 13. And the next one is my national award with a badge of musician. And I am a batch of 2012 MBBS from KC Mangalore. And my dean was kind enough to give me permission for pursuing bachelor's and master's in Veena. And when I went to Harvard, so this is how I was introduced to music therapy. My mentor and the advisory dean of Harvard Medical School, he introduced me to one of the most renowned music therapists in the world. And she walked me through the world of music therapy. When I came back to start my internship, the Department of Radiation Oncology and the associate dean was very kind, and we together started this clinical trial on music therapy in head and neck cancer patients. And I also got selected for a PhD in music, the topic being music therapy in cancer patients. And upon finishing my internship, I went again to US for pursuing clinical rotations in my area of interest, which is oncology. I was deeply appreciated and supported for my project in this clinical trial and as well as other projects on music therapy. And one of them was Dr. Eric Kendall, the Nobel laureate of 2000, and he won Nobel for inventing how memory is stored in neurons. And he also gave me this book on arts and medicine, seeing my interest in music and oncology, and that was a huge inspiration for me to start this session of oncology and strings. And that's how I went to Stanford and gave this talk. And it's very interesting that very recently I had a chat with one of the attendees of my lecture. She was also a Hollywood actress, and she's basically an American, and she is buying a Veena for herself and for her 3 daughters. And she quoted that, "Thank you for introducing me to such a powerful healing instrument." I thought of discussing that anecdote. Okay. What is the national instrument of India? So I think thanks to Pandit Ravi Shankar, when he left India for touring with his sitar, he popularized, and like right now it is the face, like sitar is the face of Indian classical music. So, but yes, it's Saraswati Veena. How many of you listen to music every day? Okay. And once a week? Okay, so in conclusion, we all listen to music and it's an inevitable part of our lives. And now what? On a personal note, I listen to music because it stimulates my brain. If I'm sad, if I'm a bit depressed, when a paper gets rejected or something like that, I listen to music. So how many, I just wanted to know, why do you listen to music? Any answers? What do you think, Pregna? Why do you listen to music?
It makes you want to see life in a better way every day, want to get up and work every single day.
Great, great. So, this is Dr. Vivek Murthy, and he, in a TED talk recently, told that how happiness is a powerful tool for health. And he says that it lowers cortisol, which is the stress hormone. Cortisol has so many other things as well. It decreases the immune strength, etc., but it lowers cortisol. And happiness lowers cortisol, and it gives a favorable heart rate, blood pressure, and strengthens immune system. It reduces the inflammatory markers like C-reactive protein. It's a triangle of thought. So music, we all listen to music. It's an inevitable part of our lives. And secondly, it gives us happiness. It puts us in a very positive mental state. And thirdly, music gives happiness, and that kind of gives health, like a good health, right? So now, the definition of music therapy is that clinical and evidence-based use of music interventions to accomplish individualized goals. I will talk about it later. What are the individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. Now, it's divided into two, therapeutic and clinical. If you listen to music as a doctor or a patient in an outpatient clinic or in an operating room or in a chemo infusion center, that is therapeutic music therapy, and that's more like a passive listening. Then coming to clinical music therapy, that is when it's a research-based discipline, and if a patient is listening to music therapy for a stipulated amount of time, that's kind of an active listening, that's clinical music therapy. Now, the individualized goals are managing stress, alleviating pain, evoking emotions, enhance memory. Now, an Indian classical music student or a dance student learns this from childhood, that there are 9 states or emotions, and a dance student is supposed to enact it out and evoke these emotions to the audience, and music student is supposed to evoke these emotions into the listener. For example, love, the ragam Vrindavan Saranga, that kind of evokes love. For example, it goes like this. That's Vrindavan Saranga. Courage, Ragam Nata, that evokes courage. For example, Jaya 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 Janaki Kanta Jaya Sadhu Jana Vinuta Jaya Tu Mahimananda Jaya Bhagyavanta Jaya Jaya. Sorrow. Pantwarali evokes sorrow. So on and so forth. But if you ask me if music can evoke anger, yes, there is a ragam called Adhana that evokes anger. Now, American Music Therapy Association has defined that clinically, music therapy has significant effect in myocardial, in increasing the quality of life of myocardial infarction patients and reducing stress, reducing anxiety, post-operative pain. So when I was applying for PhD, there was a orthopedician, he's also a Veena player. So his 3-year PhD thesis was on post-operative pain, how Veena has effect in reducing post-operative pain in orthopedic patients. Next is my area of interest, which is chemotherapy and radiation therapy induced stress. Then comes bone marrow transplantation. American Society of Hypertension recently published in their website that there are publications going on which states music therapy reduces hypertension. This is a publication from one of the best cancer programs in the world, which is Memorial Sloan Cancer Center in New York. And they have done this study on music therapy for mood disturbance in stem cell transplantation, which shows 28% reduction in combined anxiety and depression scale and 37% reduction in total mood disturbance compared to non-music doing. Then this is another project published by Cleveland program, which is again a good program. They say that the music therapy patients require significantly fewer morphine equivalent doses compared to the no music wing. This is again another project done in radiation oncology department, and they conducted this study in breast cancer and head and neck cancer patients. They also say that there is a significant reduction in stress. American Society of Clinical Oncology is one of the biggest and like the largest and the most respected platform for clinical oncologists globally, and they have written in their this article in their website showing that there was a systematic review done which shows 52 clinical trials involving 3,731 patients in which they found that music has beneficial effect on anxiety, pain, fatigue, quality of life and small effects on vitals. Now, I would pause here and think that if there is a publication in any JM on a drug discovery, it'll be like one clinical trial and like 10,000 patients, right? But here it's like there are 52 trials and there are only like 3,731 patients, and I think probably it's because the patients are not giving consent mostly. It's kind of interesting because music is a non-invasive intervention. Still, there are not many people who comes up with that. And secondly, we need to have more clinical trials. Journal of Clinical Oncology is one of the very good impact factor journals in oncology. It's a publication by ASCO, and they did this study on breast cancer patients undergoing breast surgery, effect of music therapy on anesthesia requirements. They had this live music and recorded music, and they say that they found that live music group had a shorter recovery time compared to recorded music. Now we know that from these publications that, okay, music has some effect with pain, anxiety, mood disturbance, and how is that? So functional MRI shows that the ventral striatum, the dorsomedial midbrain, the amygdala and the hippocampus, they are the pathways related with pain, anxiety and depressions, and music also has the same neuronal pathway. And now this is the sagittal view of neuroanatomic regions affected by music, and it is also implicated in the pathophysiology of pain, anxiety and depression. So they are periaqueductal gray, ventral tegmental area, nucleus accumbens and subcallosal cingulate region. Because of all these things, I strongly think that if we have enough funds, we should have live music therapy as part of the treatment, or if not funded, we should have recorded music therapy. And why? Because we do have enough evidences, it's a cost-effective process, and it's non-invasive, zero side effects, and it's fun. Now, every year in India, there are so many, around hundreds of students graduating out of art schools, graduating from like music. So if we could use those resources like in hospital receptions as like live music, vocal or instrumental, like pre-operative area, post-operative area, chemo infusion centers, that will be a great thing, great introduction. Now, Indian classical music. It has the most complex combination of musical grammar in the world, and there is South Indian and North Indian classical music. South Indian or Carnatic is the music in which I am trained in, so I can talk more about it. So there are 22 notes per octave in Carnatic, in South Indian classical music, versus 1 to 12 notes per octave in Western. And now when I was giving this talk at Stanford, one of the residents pointed out, why is that significant? So there are, initially when I mentioned, there are so many ragams which evoke love or courage. With these 22 notes, the permutation and combination of ragas which we can make is like innumerable. So we have a broader spectrum to give to the patient. If a patient didn't like one ragam, we can sort out to something else. We do have a broader spectrum, and there are 35 rhythms. It's not one or two. We have 35 rhythms in Thala. And now, this is a very interesting picture. How many of you here have gone to a yoga class or is going to a yoga class? Okay, that's interesting. Like at Stanford, probably around 80% was going to a yoga class. Okay. So what do you understand by this word called chakra? You'll be taught there, right, in the yoga class. What is a chakra? What is your understanding of a chakra? Yeah, basically that's something like an energy level, right? Energy, yeah. So, yoga, what is yoga? Yoga is a mental or physical or a spiritual practice where you awaken these chakras. So, chakras are nothing but energy centers. There are so many chakras in the human body, but these 7 are very important. And it lies in the axial line, starts from the vertebral column to the glabella. 7 of them have 7 importance. One evokes love, one evokes consciousness, etc., etc. But what I'm trying to say is, earlier when I said there are 22 notes, the 22 notes in classical music derives from the 7 fundamental basic notes, which is Sa Re Ga Ma Pa Dha Ni. We have a million compositions in classical music, and all those million compositions is nothing but just the permutation and combination of these 7 notes. So the whole point of this slide is music is equivalent to meditation. So what you do in yoga, whatever relaxation or meditation practices you have, it is the same thing in music when you listen to music or play a musical instrument. This is one of the very, very popular compositions in classical music, composed by Saint Tyagaraja, which explains this concept. It was written hundreds of years ago. It goes like this. Shubhillu satta swara, shubhillu satta swara, sundarula bhajimbhavi manasa, shubhillu satta swara. O mind, praise the divine forms of the 7 musical notes. Nabhi neck, tongue, and the nose of the human body. Which shine in the 4 Vedas and the sublime Gayatri mantra as its essence, which sparkle in the hearts of the celestials of Varti Bhusaras and of Tyagaraja. So I advocate instrumental music therapy over vocal. Music is universal, yes, but if a patient is undergoing chemo or radiation, and if it's like American patients and I'm playing a Malayalam song, it wouldn't be appreciated much. So for that purpose, if we can take out that language barrier, that'd be great. So instrumental would be great for that. And secondly, there are 5 to 7 octaves or double octaves which could be played in an instrument, be it veena or violin or cello or guitar, be it any instrument. But in vocal, even if it's a great singer, she or he can sing only up to 3 octaves. So we have again more spectrum. At a time, in an instrument, you can play up to 1 or 2 or 3 notes at a time, but in mono, in vocal, we can only sing 1 note at a time. And vibrations is another thing. If it's a stringed instrument, live music therapy is the best because there is transmission of vibrations. So that's very peculiar and important. So because of all these things, instrumental music therapy is effective, and I advocate that over vocal. there are so many types of veena. One is Mohana veena, Saraswati veena, Rudra veena, Vichitra veena. But Saraswati veena is the national important and it's the basic veena. What is the meaning of this word veena? It comes from Sanskrit. It says Vaniti iti veena. Anything that which can be played is a veena. So human body is a veena. It's called Gatra veena, and the strings being the vocal cord. Violin could be a veena. Anything that which can be played is a veena. It's a fretted plucked 7-stringed instrument with 24 frets, made of bell metal, which is a brass-like alloy. There are 7 strings, 4 main and 3 the tala accompanying strings. The standard size of a veena is 4 feet, and the veena is tuned at 150 Hz as fundamental frequency of 2.5 octave, and it's not just written from any old script or something. So a wonderful set of physicists at BITS Pilani, they did this experimental physics project on how veena could be tuned and when would veena get a very good voice, like a favorable tone, and what should be that frequency. So veena, since it has like around like 7 strings and the frequency varies from 0.375 times frequency to up until twice the basic fundamental frequency, it has to be tuned at 2.5 or 150 Hz. And now it's a very ancient instrument. It was kind of devised in 1700 BC. Coming to acoustics of veena, this is very interesting. I was learning veena all these years, and I found out this paper like maybe 2 weeks ago. So this paper was by C.V. Raman, Nobel laureate for physics. It's the first ever published paper on veena's acoustics and her remarkable tonal quality. And why is veena's sound very different and very unique and very significant for humans, the human ear, that is powerful series of overtones. Now he goes like this. This concept was confirmed by a project done by IIT Kharagpur set of physicists, and the bridge of veena is of very much importance. The upper surface of the bridge is of curved metal and the strings leaves it at a tangent. So that is, for a fretted stringed instrument, it has a broad bridge, and that makes it very special and unique from any other instrument. They all have, like rest all have a sharp bridge. Some non-medical discussions. Veena, from like growing up in a village in Kerala, I have seen all these yoga classes keeping veena for meditation. And I have seen so many people, like even like in Chennai and all, like for relaxation, they have centers where they play veena. So it's kind of very important. And it's an auspicious instrument. It's played in temples and ceremonies. And next one is kind of very interesting, that if there is a pregnant woman, there is a culture or tradition of playing veena when, like at the 8th month of gestation. They say that there is a spatial reasoning, and the spatial reasoning and music has a similar pathway, so the baby will have a greater spatial reasoning compared to the rest of us. I'm not quite sure of the science behind that, but that's what they have said. And there is no published paper on that. And secondly, there will be more brain activity, and the baby will have more focus when he or she grows up. And just like Mysore sandal or Kanchivaram sari, Tanjavur veena, because of its specific and unique make, it has got a geographic indication tag, GI tag. This is a picture I have taken from this book published in 1936 in Kannada language called Veda Prakashike, that compares veena with a human body. 24 frets are compared to 24 pre-sacral vertebrae, 7 strings are compared with the spinal cord, and dragon head is compared to the sacrum and coccyx, resonator is compared to the brain. And as the vertebral discs get thicker as you go to the caudal end. The same with vena, the threads get thick. Now there is a thought process in Hinduism from early on that the 24 threads are compared to 24 letters of Gayatri Mantra, and the 7 strings are compared to the 4 compared to the Vedas, Rig, Sama, Atharva and Yajur, and the 3 drone strings compared to Icha Shakti, Jnana Shakti and Kriya Shakti. That's the thought process again. And yes, South Indian classical musicians believe in creating the aura of a season or time of the day. This was told by one of the very, very good Vainikas currently, Jayanti Kumaresh. And it's just that for every season, for rain there is Amritavashini, for spring there is Vasanta. They say that you have to play it at that particular time. If it's raining, you have to play Amritavashini. But she has this concept of it's not like that. Even at summer, you can sing Amritavashini or Vasanta. So because South Indian musicians can evoke that feeling in anyone at any time. So I am going to demonstrate 2 main raga. One is Amritavashini that evokes the feeling of rain, and second one of ocean waves, that's called Samudrapriya. But I'll start with a normal concert piece, first 2. Thank you. First I'm going to play Varnam, so that's a concert piece which comprises of 9 ragas. It's called a garland of ragas. to a raga called Nata. So that's the music therapy piece.
next one is Amritavashini, the one that evokes the feeling of rain. This one is Samudrapriya.
post-op area, there are many patients who may like different types of music. How can you equate music with everyone?
Everyone, I'm not sure. So what I can say right now is that what I have seen as a, so what you said is a therapeutic music therapy, right, sir? So I have seen at Stanford and Harvard, especially where I was trained at, there will be a musician who will be playing a piano or a violin on a corner on a smooth, like a soothing, relaxing music. And so as you asked whether that's interesting or appealing to everyone, I'm not sure. What you can see that we can provide like a phone or something, because that's again needs a lot of funding, like for every patient keeping something. But instead keeping something like a soothing, in a very low volume, something which could be, if not appreciated by everyone, something which is very relaxing and not creating any nuisance or not disinterest to people. But we cannot probably interest everybody and play jazz a bit, and rock a bit, and classic a bit. What we can do is put a very soothing music somewhere around a corner, which is kind of appealing to most of them.
I'd like to acknowledge the presence of Mrs. Bhavana Achan, who is a renowned Veena player. She's from Manipal. Any comments?
Thank you, ma'am, for coming.
Ma'am, would you like to say something? Naveen seconds, Dr. Naveen seconds. Would you like to end the conclusion?
Thank you, Dr. Tara Rajendran.
Thank you so much, sir.
It was a wonderful performance and a brilliant CV for us all to aspire for and to look forward for. And I think at a very young age, you have millions of achievement. It's a
Thank you
very
so much, sir.
rare finding. So we are really privileged to have you. And I represent the Manipal Comprehensive Cancer Care Center and all the people from there. It's a Monday evening, so maybe we are unable to come in great numbers, but whoever have really come with lots of interest for your work and really appreciate your work, and we really wish you a lot of success in what you do in the future. Personally, I was introduced to music therapy way back in 2014. I have a friend from Germany, her name is Cordula Dietrich.
Yeah, I know her.
Okay.
The body tambura.
She has introduced a concept called as a body tambura, where the musical instrument is placed on the body of the person and played. And we conducted a workshop in the year 2017 at Tata Memorial Hospital on some patients, and also some of us were patients, and we found that it has got quite an effective role, especially in pain management, in myofascial pain, in post-breast cancer and head and neck cancer. It has an immediate relief in not just hearing the sound but feeling the sound, the vibrations of that, and that's a very effective tool. And she has published it in the Indian Journal of Palliative Care, and I've seen some of her work being published. So it's, and we also have read through some of the systematic reviews on music therapy. So I'm sure with our cancer team you can very closely collaborate and work, not just the Stanford and Harvard, but humble Manipal Cancer Care Center also you can work with, and we are happy for you to work with our team also.
Yes, definitely.
And I really thank our team also after a busy OPD for coming here, and all the other participants who have come here. Thank you so much for your time.
Now it was give a small memento to Dr. Tara.
I would like to have two words.
Yes. After.
Namaste.
I am Vidushi Pavana Bihachar. I have been training students from Manipal, and one of my students recently he passed out. He got an MD seat in Bangalore Medical College. He's very good. His name is Ramakrishnan. So we have been going through this Veena therapy locally, and we have played to Simantans, as you have told, and we have a very good rapport. The couple, along with the, you tell Burude, this resonating structure. So when we keep this on the body part and play, we can have vibrations of the fetus also, along with the music, whatever music we play, so that we also feel that along with the couple, along with the fetus, we also feel that. So surely there is a very positive and strong vibration which we also get joy from that. And not only the Seemantam, that is the baby showers, even I don't know whether all of you know about Upanayanam. Upanayanam is a Brahmin, where they get the rebirth, they get the Veda knowledge. So that time also we are called, and especially the Veena has a specific important role there. After the Veda, after the Gayatri Mantra is recited to the boy, then they call us here, especially in Udupi, Madhva Sampradaya as well as Shaivites, they call us, and we have to play some specific ragas, and Sri Raga, all those auspicious ragas. And in the case of Upanayana, it is Mohana, Revati, most of the mantras are in Revati. So I have attained that vibration, and I really am very, very joyfully involved in such ceremonies. And it's not just a saying, it is an involvement of 24 years in this Veena. It's a great instrument. And I'm having students here, Mr. Vinay, he's in 3rd year I think, and in the engineering sector, and they have multiple thinking capacities and various fields they are excelling. I'm very grateful that I am in this field, and thank you. Tara, also you have to spread this knowledge. Thank you.
Thank you so much, ma'am.
Thank you, Pavana Madam, for sharing your experiences. I now request Dr. Naveen to hand over a small memento to Dr. Tara. Thank you all for being here. We shall end with this positive note. Thank you.